Hi, I am Dr. Ariel Lopez-Chavez. I'm a medical oncologist, and in this video, I'm going to talk to you about the two most important things that every patient with lung cancer should know. Okay, well, let's get started. So, the two most important things that every patient with lung cancer should know is, first of all, the type of cancer that they have, and second, the stage of the cancer. Okay, so let's talk a little bit more about each one of those things. Now, the first thing is the type of lung cancer. And in general, lung cancer is divided in two different types. One it's called small cell lung cancer, and the other one is called non-small cell lung cancer. And essentially, small cell lung cancer, it's called like that because when we look at the cells of the cancer in the microscope, then those cells are very tiny. On the other hand, whenever the cells are not tiny, then that means that is non-small cell lung cancer. Okay, and non-small cell lung cancer is divided into many different types. Okay, so if you're told that you have non-small cell lung cancer, your next question to your doctor should be, what type of non-small cell lung cancer? Okay, and here we're gonna get into very technical names, but it is important for every person with lung cancer to know exactly the type of non-small cell lung cancer that they have. First would be adenocarcinoma, which is the most common type of non-small cell lung cancer, and actually the most common type of lung cancer whatsoever. Second would be squamous cell carcinoma. Then there's another one called large cell carcinoma. Neuroendocrine carcinomas are also part of non-small cell lung cancer. And there is something called non-otherwise specified non-small cell lung cancer. Okay, and that's when the doctors cannot really figure out what type of non-small cell lung cancer that is. Okay, so it's very important that even though these names are technical, then you ask your doctor specifically for the technical name of your cancer. Okay, so the second most important thing everybody should know is the stage. Okay, and the stage essentially allows doctors to classify the cancer according to the size, where it is located, and how spread it is. Okay, so it's very important to know this information, because with this information, the doctors are going to figure out the treatment and are going to be able to give you answers about your prognosis. Okay, so in general, like in many other cancers, we have four different lung cancer stages. Okay, uh, stage 1 cancers are in general small cancers that are just limited to one organ, for example, the lungs in this case. Okay, so let's say that the cancer is very small, 1 or 2 centimeters, and it's just in the right lung, for example. That is what we call a stage 1 lung cancer. Stage 2, it's a little bit bigger. In the case of lung cancer, 3 to 6 centimeters, and maybe spread to one of the lymph nodes, um, in the lungs, within the same lung. So let's say if you have a right-sided small cancer, then and one lymph node involved also on the same lung, then that would be stage 2. Stage 3, in general, it's they're bigger tumors. Some of them are invading blood vessels right in the middle of the chest, or um, they're invading lymph nodes right in the middle of the chest, in a region called the mediastinum, that is right in the middle of the chest. Those are generally called stage 3. And stage 4 is for cancers that have spread outside of the lung. So let's say that if the cancer has spread from the right side to the left side, or to the left lung, then that's a stage 4 cancer. Or cancers that have spread, let's say, to the brain, to the liver, to the stomach, to the bones, those are considered stage 4 cancers. Okay, and in general, the stage basically only means that talks to us about the location of the cancer, the size of the cancer, and how spread it is. Okay, now what to do with this information? Okay, well, first of all, the better informed you are, the better. Okay, why? Because then with that information, okay, with the specific technical name of your cancer and the stage, then you will be able to go online, and do a search and find more information, more specific information about your cancer. Because you have to remember that treatment for lung cancer, it's very different if it's a stage 1 versus a stage 4. Okay, and also the treatment can be very different if it's a squamous cell carcinoma versus an adenocarcinoma versus a small cell lung cancer. Okay, and that's why it's very important to have those two pieces of information. And the other important thing is that then you will be able to ask more questions to your doctors, okay, about things that you actually read about your cancer, and you will have more confidence and more peace of mind that you know really what's going on with your disease. You will be able to tell your family and loved ones more information about your disease, and that will definitely give you more peace of mind. So well, that's all the information that I have for you. Remember, very important to know the type of cancer and the stage of your lung cancer before you look up for any information about your cancer. Thank you so much for listening, and please stay tuned for other videos about lung cancer and other cancers here in Together Against Cancer. Thank you.